Hello, everybody. Welcome to today's video lecture, and we are covering the muscular system. Let's go ahead and begin. So if you look at your skeletal muscles, they have 2 points of attachment to your bones. And one point we call origin. And origin is attached to stabilized bone. And the second point is insertion. Insertion attached to movable end of a muscle and attached to bones that being pulled, right? So we have origin and we have insertion. Now your muscles can only pull, they cannot push. So they always will pull insertion towards origin, right? So we can divide muscles into prime mover, synergist, and antagonist. Prime mover is a principal muscle involved in a movement at a particular joint. Synergist assist prime mover, and antagonist oppose action of prime mover. Right, so for example, if we will take a bicep brachii muscle, this will be our prime mover at the elbow joint. So it's actually gonna pull your forearm towards your arm, right? Now brachioradialis will be a synergist. It's a smaller and weaker muscle. It will assist a bicep brachii in flexion of elbow. And tricep brachii will be antagonist because it will oppose the action of biceps brachii and brachioradialis. So it will extend your arm at the elbow joint. So over here we have some other examples of agonist. Agonist is another name for prime mover. So for example, hamstring group or flexor digitorum superficialis, and those muscles will have their antagonist that they will oppose their movement, right? And this you can see what movement are produced at those joints that those muscles act upon on. Now, you already know that muscle cells organized into fascicles, right? So individual muscle cells are covered by endomysium, then those cells are organized into bundles covered by perimysium, and those bundles we call fascicles. So fascicle is bundled group of muscle fibers, and remember, muscle fiber is the same as muscle cell. Arrangement of those fascicles is correlated to the force and affects range and motion. So we have several types of fascicle organization. So in the picture over here, you see parallel fascicle arrangement. So they arrange in the same direction as long axis, and those muscles usually have a muscle belly, right? And they have, again, origin and insertion. So here you can see fusiform, right? It's example of the parallel muscles that is bicep brachii. So then we can have a circular arrangement of muscles. Those muscles form sphincters and they relax to increase size of opening. So example over here is your orbicularis oris. Convergent muscle arrangement. When we have a widespread expansion and fascicles come to single attachment. So the origin is very widespread over here, right? So you can see example, your pectoralis major. So you have very widespread of the origin, and then insertion come to a single point, right? To the single tendon. And this arrangement allow you actually to pull into different directions. So for example, this muscle fibers will pull in this direction, those in this direction. And those superior muscle fibers pull in a different direction. So that give you bigger range of motion. So here's our fusiform again. Fusiform, when we have spindle-shaped muscles with parallel fibers. So if you look over here, we already mentioned that we have parallel arrangement, right? And one example of parallel arrangement will be fusiform, right? When we have parallel fibers and we have a belly of a muscle, that bicep brachii, tricep brachii would be examples. Pennate muscles, they pull at an angle. And when we're talking about pennate, we have unipennate, bipennate, and multipennate. So you can see over here, this is example of unipennate arrangement. Extensor digitorum longus is one of the muscles that has this structure. So fascicles on one side of tendon. Right, so this what's shown here in white color, that's your tendon, and then we have fascicle that arrange at angle to this tendon, and they on one side. Now, if you have bipennate muscles, rectus femoris, for example, then we have fascicles on both sides of tendon. So again, we have tendon in the middle, right? And we have this way. Fascicles on both sides, and multipennate muscles fibers wrap around tendon. So deltoid would be example. Right, so here we can see again kind of like summary of a muscle fascicle organization. So you have circular, you have parallel, convergent, unipennate, bipennate, multipennate, and fusiform as a separate arrangement over here. However, fascicles will be parallel. And now you can look exactly where they're located on the body. Now on this diagram, you can see anterior view, and on a anterior view of a person. And on the right, we can see superficial muscles, and on the left, we see deeper muscles. Now we have 650 muscles, and one reason why we have so many is because muscles are in layers. We have superficial, we have intermediate, we have deep muscles. Now all those muscles we need to memorize. Now we will have our lab when we will cover those muscles in details, and we can always refer back to this picture to find them on this diagram, right? And this is posterior view. Over here, we mostly seeing only superficial muscles. We cannot see many of deep muscles over here. Now this white structure are tendons or aponeurosis, and those are not muscle tissue. Those are made of connective tissue, and tendons and aponeurosis attaches your muscles to your bones. Right, so now we will go over some individual muscles into more details, right? And then we can go back to this overall diagram to find the allocation in relationship to different muscles. So we're gonna start with muscles that move the eye. We call them extrinsic eye muscles. So they originate outside the eye and insert onto outer surface of the white of the eye. So if you look at your eyeball, you see this white, very tough connective tissue that called sclera. And so those muscles will attach to sclera, and they will move your eyeball. So here are all the muscles that shown on this picture, right? So we have 4 rectus muscles, and rectus means straight. So we have superior rectus, shown here in purple. We have inferior rectus, shown in blue. We have a lateral rectus, shown in green, and medial rectus, shown in pink. All right, and then we have 2 oblique muscles. We have superior oblique shown in yellow, and we have, I don't know if it shows this inferior oblique over here, this one right here, shown in this brown color, right? Now, when we have our lab, we will learn the direction those muscles pull your eyeball, right? So that will come up. Right now, we pretty much just looking at location of those muscles. Muscles of the head are divided into two groups: muscles of facial expression and muscles of mastication and tongue movement. So let's go ahead and start with muscle of facial expression. They insert into skin, and important in nonverbal communication, they all innervated by facial nerve, right? It's nerve number 7. So facial expression, facial nerve. And on this diagram here, you see our first muscle called epicranius or occipita frontalis, or sometimes we even call it frontalis and occipitalis. But it's one muscle that has two bellies. The frontal belly, frontalis, and posterior belly is occipitalis. And they connected by cranial aponeurosis. They pull skull forward and backward. Now, if we look at this diagram, we have orbicularis oculi. Those are circular muscle that's surrounding your eye, right here. Then we have orbicularis oris. So let's just orbicularis oculi, orbicularis oris is this muscle right here. Then we have a procerus muscle, that muscle right there. Yeah, you see, I have red color, red on red, cannot see very well. So let me see if I can change my color. I know I can, of course, but let's take a blue, right? Let's see if I use blue, will it work or not? Okay, so orbicularis oculi, no, it's always go back to red. I don't know why. Okay, so let me just then keep it like this, and I can have different colors. Now I can choose blue. All right, so I guess I got it right. So orbicularis oculi, right there. Orbicularis oris, this muscle right here. Procerus, this muscle right there. Corrugator. Now corrugator muscles are deep, so you can see only left corrugator, but they will be deep to your frontalis and procerus. Zygomaticus. So here's our zygomaticus. We have zygomaticus minor and zygomaticus major. Orbicularis oris, I already show you. Buccinator muscle is the muscle of your cheek right here. Mentalis is this muscle over here. Dau is depressor angula oris. That is this triangular muscle right here. And platysma is a very thin muscle found in your neck region, right? So that's a platysma. Okay. Next one we have muscles of mastication. 4 pairs involved in mastication, and all those muscles are innervated by cranial nerve number 5, that is trigeminal nerve. So muscle of facial expression, I want to remind you, are innervated by facial nerve. muscles of mastication by trigeminal nerve. And over here, we see temporalis, that is muscle right here, right? And masseter. And insertion of this muscle will be your mandible, because the only bones that you can move is your lower jaw. So that's your mandible. So if you want to move your mandible, you better insert your muscle into that bone. Now here we have muscles of the tongue. 3 muscles anchor and move your tongue: genioglossus, hyoglossus, and styloglossus. Now, all of them have this word glossus, that means tongue, right? So genioglossus is muscle right here. Hyoglossus is muscle that originate on hyoid bone, that's why it's higher, and insert into tongue, so that would be your hyoglossus. And styloglossus will be this one muscle. So that's styloid process, so that's a styloglossus muscle. So you can see the insertion is your tongue, right? But origin is different. The genoglossus originate at mandible. Hyoglossus originate at hyoid bone, and styloglossus originate at styloid process of temporal bone. Okay, now I think I can go back to my full view because I have more colors, so I can use really a red color to show you those muscles. Now we move into muscles of the neck. Now muscles of neck divided into anterior triangle, so that would be anterior triangle, and posterior triangle. And what divides muscles into these 2 groups is your sternocleidomastoid. So this shown in green, right? This muscle over here is sternocleidomastoid. Very nice name because it's originate at your sternum and at your clavicle. And insertion is mastoid process. And mastoid process is right there posterior to your ear. This is a major neck flexor, sternocleidomastoid. So it flexes your neck. So in anterior triangle, you can see we have good amount of muscles here, but we're just gonna divide them just into 2 groups: suprahyoid and infrahyoid. So this is your hyoid bone. And muscles above hyoid bone will be muscles of suprahyoid group, and muscles below, so all muscles over here, will be your suprahyoid, and all muscles over here in the anterior triangle will be infrahyoid muscles. Most of them involved in swallowing and head flexion. Posterior triangle, we can see scalene muscles, lineus capitis, and levator scapula. So here, green one, again, show you sternocleidomastoid. Then this triangle that underlined by dots, this is our posterior triangle. And those purple muscles will be our scalene muscles. The next is our levator scapula. That will elevate your scapula, and then we have splenius capitis. So scalene muscles, they on the side, so they're responsible for side flexion. Splenius capitis for extension of your neck and rotation, and levator scapula, as I already told you, elevates your scapula. Now we have 3 scalene muscles. We have anterior scalene, middle scalene, and posterior scalene. And posterior scalene, I think we can just see a little piece of it. We cannot really see this muscle precisely. Diaphragm. Diaphragm is a skeletal muscle that separates thoracic and abdominal cavities. It's involved in the breathing, and it's dome-shaped at rest. So you can see that we have a right dome and we have a left dome, and we have a right cruise and left cruise that attaches diaphragm to the vertebra. So a diaphragm has 3 openings. It has caval opening. So that's the opening for your inferior vena cava. So inferior vena cava will move through the diaphragm from abdominal to thoracic area. So we have caval opening. Esophageal hiatus, that is, area where esophagus will move from a thoracic cavity to abdominal, and aortic hiatus, where aorta will move from thoracic to abdominal area. Now your diaphragm is involved in what is called a Valsalva maneuver. And if you want to try Valsalva maneuver, you can just keep your mouth closed and try to exhale air without actually exhaling it. So imagine that you take a lot of air into your lungs, right? And then try to exhale it as hard as you can, but don't exhale anything. That's what Valsalva maneuver is. And it's important in defecation, urination, and childbirth. Now we're moving to abdominal wall, and we have 4 muscles over here. Rectus abdominis shown here in green color. Then the most superficial muscle is external oblique shown in purple. Underneath of external oblique, we have internal oblique shown in pink, and the deepest muscle is transverse abdominis. So you can see how those muscles are arranged into layers. Now, rectus abdominis is a superficial muscle, but it will be covered by this white structure that is aponeurosis, so that aponeurosis of external oblique. Also, another structure that we can see over here is this line in the middle. It's a tendon called linea alba. Linea means line and alba means wide. Then we have linea semilunaris, those lines right here. They divide, I'm sorry, no. Linea semilunaris are those lines. So it will be here and here. And those are tendinous intersections. Yeah, those are tendinous intersections, and they divide your rectus abdominis into what we call 6-pack, right? So we have 1, 2, 3. So 1, 2, 3, 1, 2, 3. So we have the 6 packs. So again, we have linea alba in the middle. We have linea semilunaris on the lateral side from linea alba, and tendinous intersections are horizontal tendons. Here, actually, you can see those abdominal muscles individually, right? So let's go now start with this transversus abdominis, right? Then on the top of it, we have internal oblique and rectus abdominis, and then everything is covered by external oblique and aponeurosis of the external oblique. Back muscles, and we're gonna start with deep muscles over here. So you can see splenius capitis, splenius cervicus, shown on the first picture. Splenius capitis is brown, cervicus is in yellow, and they are important for head extension, rotation, and lateral bending. And deep muscles are shown on the second pictures. We have, again, it's a group of muscles, and group is called erector spinae muscle, important for back extension and lateral bending. Now, there are 3 major muscles that make erector spinae: spinalis, longissimus, and iliocostalis, shown here in different color. Spinalis is blue, longissimus yellow, and iliocostalis is brown. Now, all these 3 muscles together are called erector spinae muscle. So here you can see superficial muscles of the back. We have trapezius muscle. We have latissimus dorsi, that is inferior to trapezius. And deep to trapezius, we have our rhomboid minor and major. And we already saw this levator scapula in the posterior triangle of the neck. So main function to stabilize and move the scapula. But for latissimus dorsi, the main function is to move your arm. And it's involved slightly into lateral flexion of spine. But those muscles like trapezius, rhomboidus minor, major, and levator scapula, they insert into your scapula. So they stabilize and move your scapula. And latissimus dorsi is inserting into humerus. That is the bone of your upper arm. So it's gonna move your upper arm, right? It's gonna flex it. Muscle of the thoracic wall. So this is anterior view. We have pectoralis major muscle, most superficial. And then underneath, we have pectoralis minor. So here's the pectoralis minor. We have serratus anterior muscle shown here in blue. And then we have muscles between your ribs that called intercostal. So we have internal intercostal, deeper muscles, and external intercostal, shown here in green, that they are more superficial. So now let's put those muscles into perspective and into groups. So the first group we see over here is called scapula sling muscles. That means those muscles are they insert into scapula and they move and stabilize, make your scapula more stable, right? And here's mnemonic to remember those muscles. Roger Rabbit loves to smoke pot. So if you put the first letter of each word, you have these 6 muscles that are part of scapula sling muscle. So it's rhomboidus major, rhomboidus minor, or rhomboid major, rhomboid minor. So we have here our rhomboidus minor, right there, rhomboidus major. Then we have levator scapular muscle, right over here, trapezius, and serratus anterior and pectoralis minor can be seen from the anterior view, right there. Serratus anterior and pectoralis minor, right? That means all those muscles, where do they insert? They insert into scapula. Another group of muscles that move upper arm, mnemonic is lady between 2 majors. So we have our lady latissimus dorsi. So here's a big muscle over here on the posterior side, latissimus dorsi. And then we have our pectoralis major and minor that actually, let's go back over here. So this is our pectoralis major, right? Oh, it's not pectoralis minor, teres major. So pectoralis major over here and teres major. Okay, where's our teres major? It's actually muscle right here. So that's our teres major muscle. And this is a posterior view. Yes, posterior view. So this muscle over here that is not color, this one is our teres major. And of course, deltoid muscle that also moves your upper arm. So lady between 2 majors and deltoid, those are muscles that move your upper arm, pectoralis major, teres major, and latissimus dorsi. The teres major, it would be a muscle that kind of right there. Right, so that's going to be our teres major. And our pectoralis major will be on anterior view right here. That's shown here in green. That's our pectoralis major. And shoulder muscles, again, it's deltoid, teres major that we already, it's looked over here, and rotator cuff muscle. Now, those muscles, they originate on the scapula, rotator cuff, and they insert into humerus. So you see, that's a humerus over here. That's a humerus bone. And we have several muscles like teres minor, infraspinatus, supraspinatus, and subscapularis, and they all insert into humerus, making this structure that we call cuff. So it's a rotator cuff, and you can imagine it's help you to rotate your arm at a shoulder joint. And mnemonic is SITS, S-I-T-S, SITS. So it's supraspinatus, infraspinatus, teres minor, and subscapularis. So over here, you can see subscapularis shown here in green. So this is anterior view, and you can see anterior view of the scapula. So that's our green one over here. That's our subscapularis. Now this is posterior view. So you can see a spine of a scapula. So that bone is spine of the scapula, and you have muscle on top. So it's a supraspinatus. Muscle below the spine, infraspinatus, and then we have our teres minor that's shown here in yellow, and below to teres minor is teres major. Right, so okay, so let's see what we have over here, what we can see. We can see pectoralis major, right? Underneath we will find pectoralis minor. We have trapezius muscle here. We can see part of the latissimus dorsi, even looking from anterior view, and we see deltoid. Now we have trapezius on the back, we have deltoid, we have latissimus dorsi. So you can see those muscles are really huge, and they take a lot of surface of your body. So those muscles we must know, right? There may be some small muscles we miss sometimes, but those huge muscles, they are necessary to remember and find and learn their location and function. All right, we're gonna move to the upper arm muscles, and your arm, upper and forearm, they divided into compartments. So upper arm is divided into anterior and posterior compartment. Now, in anterior compartment, you have your bicep brachii, that's shown here in green. Then we have coracobrachialis, this muscle over here, and brachialis, this muscle right there. So we have three muscles, biceps brachii, coracobrachialis, brachialis, and they are flexors of your arm. They flex at elbow joint, and some of them, like bicep brachii and coracobrachialis, they can also flex at a shoulder joint. Now, posterior compartment, we have only one muscle, that is tricep brachii, and this is extensor, shown here, right in green. That's our tricep brachii. Now, bicep brachii, biceps means two, and bi means two, ceps means head. So bicep brachii has two heads. It has a long head and a short head, right? So, so long head is this one over here, and a short head. So short head of the bicep brachii shown here in green. So let me just, be consistent with my picture, because whatever shown here in green, that's your short head, and whatever shown here in green is a long head, right? So that's a long head. And triceps brachii, you can guess it has three heads, or another way to say it, three origins. So three heads. We're looking at posterior view. So we will have a lateral head, that is this one, right? Then we have a medial head right over there. You cannot see it very, too well, but it's right there. That's a medial head. And then we have a long head. So that's a long one, this one. So we have lateral, medial, and long. And on this diagram, you can see the tricep brachii, right? All three heads, so 1, 2, and 3. So lateral, medial, and long. And we can see muscle that located on the scapula. So that's a scapula bone. Now this is spine of the scapula. So this is supraspinatus. Now all this muscle over here that I'm gonna highlight, this muscle is infraspinatus. So this one, infraspinatus. Now this muscle over here is teres minor, right? So that's a teres minor, and this one is teres major. Now, when we look to forearm, we have way more muscles compared with upper arm. So here we have superficial compartment, intermediate, and deep compartment. So in the first picture, we can see our superficial compartment. We have 4 muscles over here. Yellow one is pronator teres. Then we have flexor carpi radialis. Then we have palmaris longus and flexor carpi ulnaris, right? And mnemonic is pass, fail, pass, fail. So those are most superficial muscles. They all originate on this, at this area that is medial epicondyle of humerus. And the insertion gonna be different, right? But they all moving towards your head. So again, pronator teres, flexor carpi radialis, palmaris longus, flexor carpi ulnaris. Now, when we have our lab, we will find these muscles on mannequin and on your own body, right? And we will talk about, you know, those names, what they mean, and what those muscles do. Now, intermediate group is flexor digitorum superficialis. That is actually not shown on this picture, but that will be this muscle right over here. No, that will be our flexor digitorum superficialis. And underneath a flexor digitorum superficialis, we have flexor digitorum profundus. It's a deep group now, shown here in blue. Flexor pollicis longus, right here, shown in red, and pronator quadratus, shown here in green. Right, so I usually divide those muscles into 4 and 4. You know, this intermediate, I just gonna add it to deep. Then it's easy to remember. We have 4 superficial and we have 4 deep muscles, but in a reality, one muscle is intermediate, that flexor digitorum superficialis. Now, posterior compartment has 6 muscles that are superficial and 6 muscles that are deep, right? So on the posterior compartment, muscles gonna originate on the lateral side. And here they all in order. First, we have brachioradialis. Then we have in extensors. So we have extensor carpi radialis longus, and then extensor carpi radialis brevis. So they're both in blue over here. Longus just has a long tendon. That's why it's extensor carpi radialis longus. This one, extensor carpi radialis brevis. This is extensor digitorum. This one is extensor carpi ulnaris. Oh, and I missed this, extensor digiti minimi, extensor carpi ulnaris, and aconius. So that's our 6 muscles. And well, I would say aconius is not included over here. So I included it, aconius into deep compartment, again, just to make it 6 and 6. So we already see our aconius muscle, small muscle over here, shown in brown. Then we have supinator. We have abductor pollicis longus. And then we have extensor pollicis brevis and extensor pollicis longus and extensor indicis. Now, you probably like, my goodness, how am I supposed to remember? It's like millions of muscles over here. But really, if you pay close attention, you can see that in anterior compartment, we have lots of flexors. Look, we have flexor, 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 flexor. Now those names gonna tell you what those muscles flex. So flexor carpi radialis. Now what this name means. So let's look at this muscle. That's our flexor carpi radialis shown here in green. So flexor means it gonna flex. Carpi means it insertion a carpal bone. So it's your wrist. So it's not going to your fingers. It's just going to your carpal bones. So it will flex your hand at a wrist level. It's gonna flex your wrist. And why we call it radialis? Because it goes to where your thumb is. So here would your, pollex or thumb, right? So it's a radius bone is over here. So that's on the radial side. Now, flexor carpi ulnaris tells you we're gonna flex, right? We're gonna insert into carpal bones again, and we're gonna insert on the ulna side. So right there. Palmaris longus also flexor, but it will be insert into aponeurosis over here. So it's palmar aponeurosis. So it's insert into your palm, right? Now, flexor digitorum superficialis tells you it's gonna flex your digits. It's gonna flex your fingers. Flexor digitorum profundus gonna flex your fingers. Flexor pollicis longus gonna flex your pollex, that is your thumb. Pronator quadratus gonna pronate your hand, and pronation means your palm down, right? It's gonna pronate. We have supination and pronation. In the posterior compartment, you can see you have all your extensors. And extensor carpi radialis, longus and brevis, they're gonna extend, right? They're gonna insert into carpal bones on the radial side where your thumb is or pollex is, right? And then it's gonna extend your wrist because carpi are your wrist bone. Longus tells you it has a long tendon. Extensor carpi ulnaris, you're gonna extend your wrist, insertion carpal bones, and it's on the ulnar side. Extensor digiti minimi, what you're gonna extend? Your pinky, because that's your small digit, digiti minimi. And extensor digitorum, if you look at this yellow, look, the tendons goes to all the fingers except of pollex. So it's gonna extend all these 4 digits. So you can see names make sense. Now, supinator means it will put your hand in supine position. Abductor, pollicis longus, it's gonna abduct. Abduct means take away from midline. It's gonna abduct your pollex or your thumb. Extensor pollicis brevis and longus gonna extend your thumb, and extensor indicis gonna extend your index finger or your digits too, digit number 2. All right, so you can see, guys, that names, when names are long and look like they're complicated, it's actually better to memorize what those muscles do and where they insert. Now, if we look at the hand muscles, we have intrinsic muscles of the palm and we have some muscle on the dorsal regions that we're not covering here. So we're only looking at your palm. And here we're gonna divide those muscles into groups only, right? We're gonna divide it into thinner group, and it's gonna be group, where your thinner so thinner group is where your pollex is, right? Where your thumb is. And we have hypothenor group. It will be muscles right here, where your digiti minima is, or your pinky. And then we will have intermediate group, right? Everything in between them. Now, thinner group is your ball of thumb, or hypothenor group, a ball of the little finger, and intermediate group in between them flexes your fingers. So this is how much we will learn about muscles of the arm. All right, so I'm gonna stop recording right here because we covered lots of muscles. So make sure you rewatch it, right? And just so far, just try to memorize their names and where they're located. And during our lab, we will cover all these muscles in more details. We will talk about their origin, insertion, and action. But to start learning about all these details, right? First, at least, we won't be able to find them on pictures, on diagrams, on mannequins on our body. We want to find them and we want to remember their names. And then we will go into more specific details about those muscles. Now, the rest of this PowerPoint, I will cover in my next video, right? I don't want those videos to be too long. So the second part is coming up. Thank you for watching, and I hope it was helpful.